Good afternoon, and thank you for joining us today. My name is Katura Cappadonia, and I am the Outreach Consultant at the Southern Tier Library System. And today we're joined by Benny Finch from the National Network of the National Library of Medicine to present a webinar on caring for the mind, providing mental health information at your library. Benny Finch, MSW MLIS, is an education and outreach coordinator for the network of the National Library of Medicine in Region 7, located at the UMass Chan Medical School in Worcester, Massachusetts. Benny enjoys all libraries, but her specific focus is public libraries and providing equitable access to consumer health information. And we thought this would be a great time to get this webinar out there for you all, as May, which is approaching very quickly, will be Mental Health Awareness Month. So if you want to plan any programs in your library around Mental Health Awareness Month, this might be a great way to get started. During the presentation, if you have questions, please feel free to type them in the chat. I'll be watching that, and we'll bring the questions up for Benny to answer as she can. And I will go ahead and turn that over to Benny. Thank you.
Thank you so much, Katura, and thank you for that introduction. I'm so glad to be with you today. It's just going to take me 1 second to start sharing my screen, hopefully. So are you seeing a slide that says caring for the mind? Yes, okay, great. Okay, let me arrange one more thing, then I'm good to start. So thank you so much. I'm so glad to be here. And as Katura mentioned, I am with the network of the National Library of Medicine in Region 7, which is located in Worcester, Massachusetts. But I'm joining you today from my home office in Hamden, Connecticut. Some of you may be familiar with the NNLM, while others may not. But let me first start off by just telling a little bit about who the network of the National Library of Medicine are. So as the name suggests, the NNLM is part of the National Library of Medicine, which is within the National Institutes of Health. We're the education and outreach arm of the National Library of Medicine, and we work regionally, getting to know communities on the ground and helping those communities best serve the people they know best. But we are present across the entire country, and we work to advance the health and well-being of everyone through improving individuals' access to information to enable them to make informed decisions about their health. This includes working with libraries of all types, schools, healthcare, and all sorts of community-based organizations. So we do this primarily through 3 different methods: providing funding to organizations so that they can work within their own communities. And some other forms of outreach and engagement are our products and resources. And then, like today, we offer a wide range of training and education opportunities. And I encourage you all to visit nnlm.gov to learn more. As I mentioned, our Region 7 office or regional medical library is located at the University of Massachusetts Chan Medical School. But Region 7 includes 7 states: Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. And there are 4 coordinators in our office, and we're all here to help with health information access and would love to hear from you. And I'll highlight some NLM resources today from the National Library of Medicine, such as Medline Plus, but we also have other resources that we're happy to share with any who would be interested in learning more. So Caring for the Mind is a class to assist librarians, health professionals, community organizations, and anyone who has a role in providing health information. This webinar is not a course about mental health or mental health first aid or safety. As librarians, we will be focusing on what librarians and information providers do best. And that's providing reference information, providing resources, and library programming. So when providing our training, we do always reiterate that we're not trained healthcare workers and we're not going to be providing health advice, but we are able to support health information access. In today's session, we're going to cover a few mental health statistics and definitions, tips for reference interactions, and we're going to highlight some information resources. And lastly, we'll look at some ideas for programs and services around mental health that you might want to consider for your library or community. And do feel free to stop me at any time if you have questions or comments. Thanks. As an organization, you can provide quality health information for your patrons to learn about mental health topics. This could be regarding a particular mental illness. It might be during a stressful event, such as disease outbreak or a natural disaster, or even having a child. And so let's start by looking at some basic mental health definitions and statistics. So mental health includes our emotional, our psychological, and our social well-being. It affects how we think, feel, and act as we go through life. And it also helps determine how we handle stress, relate to others, and make choices. Mental illness or mental health disorders refers to a wide range of conditions and disorders that affect our mood, thinking, and behavior. And examples of mental illness include depression, anxiety, schizophrenia, eating disorders, and substance use disorders, to name just a few. A mental health condition can make life more challenging, but it's not uncommon. Many people have mental health disorders or concerns from time to time, and it becomes problematic if left unmanaged or untreated, and may then become a serious mental illness, affecting one's activities of daily living. Mental illness is prevalent across the United States. It can affect people of all ages, including children and older adults. In 2019 to 2020, 21%, which is over 50 million Americans, were experiencing a mental illness during those years. And 16% of children aged 12 to 17, or 25 million children, reported suffering from at least one major depressive episode in that year. And now we're going to switch gears to thinking about how to address mental health information requests that might come up in the library. So let's say you get a question from a patron who has a child with an eating disorder and is struggling to make sense of their child's experience. They want information. So what do you do? Well, you would use the same approach that you would with any other reference interview. Respect confidentiality by lowering your voice, or maybe bring the patron to a quiet area, but where you can still be seen by others. Active listening shows that you're paying attention by maintaining an open body position, for example, not crossing your arms and maintaining comfortable eye contact. But keep in mind that there are various cultural views on eye contact. You want to ask open-ended questions and neutral questions, which can result in getting more information and not just a yes or no answer. And be sure to let the patron finish their questions before responding. Be empathetic and patient. Know that the patron may not be aware of the potential impact or seriousness of a disorder, so be prepared for emotional reactions. And if that patron is having a hard time asking a question, be patient. Once they've asked their question, you could say something encouraging and supportive, but do not share your personal stories to demonstrate that you understand. This may convey the wrong message because each situation is different. They are there to have their needs met, and not the other way around. And in addition, sharing personal stories or examples could be construed as medical advice. So this may be difficult for some of you. It certainly can be for me, but allowing time for silence can be helpful. It may be the moment someone is taking to gather themselves, or they could be processing the information that you've provided, or determining if they want to ask further questions. You too might need a moment to think through where to look for resources and gather your own thoughts. And it's very important to know the difference, again, between providing health information and giving health advice. And as you know, we are librarians, as I've said, and we don't give medical advice. It's best to refer individuals to their healthcare providers if they have questions that are really beyond the scope of providing information. Every individual is much more than their illness. Illness does not define a person, so we need to be mindful of the words that we use because the words we use matter. We should avoid the use of expressions such as a schizophrenic or addict, and instead use the more accurate term, a person living with schizophrenia or a person with a mental health condition or mental health disorder. This thoughtfulness in language empowers the individual beyond stereotypes of the illness so that they identify mental illness as a condition and not a personality trait. And there are some situations, so typically person first language is preferred, but there are some situations in which it is not preferred. For example, in the deaf and autism communities, which are not mental illnesses, but some believe that the person can't be seen or separated from their disability and that their identity is a sense of pride. But typically we would use person first language. I briefly mentioned this on one of the slides above, but listed here are some examples of open-ended questions you might use to learn more about what the patron is looking for. I'm sure these are all familiar questions to you who are experienced doing a reference interview, but just some examples in terms of asking open-ended questions to clarify the patron's needs. Are they looking for health information? Are they looking for local services or a support group? Is it a class assignment? And that's going to impact what kind of resources that you're looking for. The examples here are that are offered are like, what kind of information are you looking for? Where have you checked for information so far? Could you tell me more about their question? When you say this, what do you mean? And what do you already know? If clarification is needed, just ask. You can say, I'm not certain I understand. Can you give me an example or tell me more? Sorry. Goodness, I zipped right on through. Okay. So I also want to take a second to mention that I'm going to be going over a number of sources of information throughout the presentation. My colleagues created a fantastic curated list of resources that I'll share at the end. So I want to let you know that there will be links to these resources I go over in that handout. So for this website, Mental Health First Aid provides these 5 tips for non-judgmental listening. Just as it's important to ask open-ended questions, it's important to also listen without judgment. So their recommendations are 1, reflect on your own state of mind. 2, adopt an attitude of acceptance. 3, develop verbal skills to show you're listening. 4, maintain positive body language. And 5, recognize cultural differences. I do also want to mention that NNLM offers an on-demand class called Introduction to Health Reference that goes into more details about library policies and more information about providing health reference. It's a fantastic class that will provide much more information about health reference, and we have a link to the registration page on that handout. And of note, we do a lot of national trainings, and all of our training is open to the public. So you can create a free user account and access any of the training that we offer. So next I'll be going over some health information resources and then some ideas and examples of programs and services to do in your library. So some of the mental health resources I'll be going over next may look familiar, but you might find some new resources to consider as well. And all of the resources that we're going to talk about or look at today are free. So this first resource I want to share with you is the NNLM guide for public libraries. Any library may find it helpful. You can see there are a number of different topics, but one of them is for mental health. This guide has some great information, and many of the resources I'll mention today are also located in that guide. And again, there's a link on that handout to this guide as well. So you may be familiar with the National Library of Medicine's consumer health resource called Medline Plus. excuse me. When I refer to consumer health information, I'm talking about information that's created for the general public. And pictured here is what the Medline Plus homepage looks like today, or most recently. And this is what Medline Plus looks like on your computer and what Medline Plus looks like on your phone. So on the right side, there's what this would look like on a phone. Medline Plus is the premier consumer health resource for the National Library of Medicine, and Medline Plus is available anytime, anywhere for free. With an internet connection, this information can be accessed from a phone, tablet, or computer. And content is designed using web accessibility best practices and is compatible with assistive technology like screen readers. Just going to get a drink of water real quick. Excuse me. It is free of advertisements. And Medline Plus offers information in both English and Spanish on over 1,000 health topics, as well as information on human genetics, medical tests, medications, and dietary supplements. Medline Plus has 40,000 links to authoritative health information in English and about 18,000 links to information in Spanish. And while there are links to resources outside of the NIH, the information has all been vetted by the National Library of Medicine. And the next page we'll look at is the information related to mental health. But I did just want to share a little bit about how Medline Plus works, just so you'd have that information. And I can also share a link to a very short video introduction to Medline Plus at the end. Okay. So I'll start by going through the steps for using Medline Plus, but I'm also happy to do a live demonstration at the end of the presentation if you would like, if that would be helpful. But I'm going to just use these screenshots to show the general process. So if you go into the Health Topics tab, you'll see categories, and one of them is mental health and behavior, which is a good place to start. You can also use the search box at the top, and it will give you lots of results all within Medline Plus. And again, one of the nice things about Medline Plus is that it also curates lots of information from other sources and organizations on their site. So you don't have to go to the American Academy of Pediatrics or familydoctor.org. You don't have to do a Google search and wonder if the search results are quality online resources. The resources included on Medline Plus are vetted and must meet Medline Plus strict criteria for inclusion before being considered and included. In addition, Medline Plus regularly reviews and updates the information contained in the resource because medical information changes rapidly, and you want to make sure that you have the most up-to-date information. So the health topic pages are organized alphabetically, and here's a health topic page on child mental health. Notice that there's a table of contents sort of at the top of that page, and you can click directly on any of these links to jump directly to that section, or you can simply scroll down to view what you're looking for. You can find information, for example, under resources about finding an expert, information that is just for the child who might have the mental health condition, and patient handouts. Some of the handouts are in different languages as well, and if that's something, in case that's something you're looking for. For a user who doesn't have information on a topic, you might find Start Here helpful. There's information and links for diagnosis and tests and on treatment and therapies, and sources are listed for where the information comes from. So for example, there are these NIH icons here on this page. So if you see that little NIH, that means that that information is coming from one of the National Institutes of Health. And regardless, there will always be a description of where the information is coming from before you click on that link. I also wanted to mention that sometimes you'll see a camera icon, and that means that it's a video resource. There's not an example on this page. And occasionally you'll see an icon for easy to read, and that means it's been written around like a 3rd to 5th grade reading level. But everything on Medline Plus is written in plain language and is around a 4th to 6th grade reading level. There are examples here in this list of resources that are available in both English and Spanish. So if that's something that you're going to need, you can see right at the beginning what's going to be available in both languages. And over to the right, you'll see a section called Related Health Topics. For example, bullying and cyberbullying and child behavior disorders and related topics are related topics to child mental health. Those might provide additional information for the user or yourself as well. And if you continue to scroll down, you'll see that there are links to journal articles in PubMed where medical literature can be found. And again, there's a section called Find an Expert, and this is going to list some organizations where you might find information. And for example, on this page, there's a link to a psychologist locator. At the bottom of the Medline Plus homepage, you'll see a link for health information in multiple languages. And if you click on that, you can scroll through a list of health conditions, or you can click on a particular language. So here on the second screenshot, you'll see that there's a list of multiple languages for handouts related to depression. And then this is an example of a handout on feeling sad in Arabic. Notice that this handout also has information in English, which is helpful if a patron takes it to their doctor so that the doctor can know what is being included in that information as well, in case they don't read the other language. All topics in a language other than English will also have a version in English if possible. And if you're printing information for a patron, we do recommend printing in both English and the other language that they're looking for. And I will make a plug for another one of our classes called Providing Multilingual and Multicultural Health Information, which is offered a few times each year, if that would be of interest to you. So you'll find a link for this page in the handout, as well as a similar link. One is for directories and one is for organizations on Medline Plus. So if you click on directories, you'll see various categories that might be helpful. In the screenshot on the right, I've scrolled down the page to other healthcare providers. And in this category, there are links to find a therapist and a psychologist locator from the American Psychological Association. And under hospitals and clinics specialized, there is a link from the Substance Abuse and Mental Health Services Administration to find treatment. And I'll show you a little bit more about SAMHSA a little later. But please don't limit yourselves to what's listed here. Your state health departments will also have information on local services that may not be included in these lists. This is just a place to start. And in case this is helpful, I did locate this resource from the New York State Office of Mental Health, which does have a resource called Find a Mental Health Program. You can choose by county and see what resources are available in that area. Okay, and going back to Medline Plus, we look at directories. We already looked at directories, and I also wanted to share that there's again, a link in the handout for this page with organizations that have also been vetted by the National Library of Medicine. So if you happen to lose these links, I also put an arrow here to show that you can always go to the site map, and that will help you find on the Medline Plus page, and that'll help you navigate to the pages for organizations or to directories if you don't have that handout. So medication may be prescribed as part of treatment for mental illness. And if that is the case, Medline Plus also has information on drugs and supplements. Medline Plus uses information provided by the American Society of Health System Pharmacists. Some of you may have used the physician's desk reference in the past or the PDR, but this is not the best resource to use, and it was apparently never intended to be used by the public. But there's tons of information about drugs and supplements on this Medline Plus page. The screenshot on the right is an example of an information page on the antidepressant escitalopram. And it has that similar table of contents at the top of the page that we saw on the Medline Plus Health Topics. But I also want you to notice the red box at the top of the page with important warning. So when the FDA issues a warning, it is highlighted in the resource, and that's where you would see that. Authoritative information about herbs and supplements is also available from Medline Plus, and you may have received questions about complementary or non-prescription drugs or supplements. This is a reliable resource to use for that information as well. For information about medication, I do suggest starting with Medline Plus, but if Medline Plus doesn't provide what you're looking for, there is another source you can turn to. This is Daily Med. Daily Med is a joint effort between the National Library of Medicine and the Food and Drug Administration, or FDA. Daily Med contains over 144,000 labels submitted to the Food and Drug Administration by drug manufacturing companies. So on the site, you can find the package inserts that are included with prescriptions. Again, these are really this resource is really meant for providers, but it is a resource on the handout. So I wanted to let you know what this is. And of course, you may also have other drug resources available in your library collections. And again, just be sure that these are as current as possible because medication information can change.
Benny, I'm sorry, may I interrupt with a question?
Sure.
Do you recommend searching for drug info by brand name?
That's a great question. You can, on the Medline, I'm happy to demonstrate this as well if we want to do that when we do after the slides. Medline Plus does have both the generic and the brand names. In fact, when you go, so if you, just for an example, if you looked up acetaminophen, there's a section on that page. There will be a warning at the top about from the FDA, but there is a section that will tell all of the, maybe not all, but many of medications by brand name that contain acetaminophen, if that makes sense. Does that answer the question?
Yes, thank you, Benny.
Okay, great. But yeah, if I might forget, but if we do decide to do a live demonstration, I'm happy to demonstrate that too. Okay. Any other questions or comments while we're taking?
Nothing else, thank you.
Okay, great. For people that are looking for complementary treatment, you can visit the National Center for Complementary and Integrative Health for authoritative information. It's one of the 27 National Institutes of Health, and there are some great resources on this site. And you'll notice at the bottom that there's information on health topics and about being an informed consumer, which are nice resources. The National Institute of Mental Health provides information on specific conditions and treatments, along with free materials that you can download or order for your library or for your personal use. And I do just want to take a second to give a plug for those. I have, there are some great resources that you might find useful, and they're free. So you can just order those, or if you want to print them yourself, you can do that as well. I also wanted to point out that this information is also available in Spanish. And on the website, there's a little tab here that you can click first to switch to Spanish. And under the mental health information tab, there is information on health topics, statistics, brochures, and fact sheets, help for mental illnesses, and more. And keep in mind that other institutes and centers may also have information, such as the National Institute on Aging or the National Institute on Minority Health, which may have mental health information that's more specific to those populations. SAMHSA is the Substance Abuse and Mental Health Services Administration agency in the U.S. Department of Health and Human Services. Its website includes information for the public and for professionals. Topics include school and campus health, seeking help after traumatic events such as natural disasters or shootings, and of course, coping with COVID-19. The screenshot here is the Find Treatment page on the SAMHSA website. SAMHSA is a good resource if you're planning a program or service, but for some people, this resource may seem overwhelming, and you might want to take some time to explore that website and select specific links that you think your patrons would find most useful. They also have publications that are free to download or order, and you might consider having some copies available at your circulation desk or creating a LibGuide or distributing these resources at a library program or if you have a brochure area. Um, some information, again, is also available in Spanish, and there are, again, these are resources that you could either download or often you can order a print copy. Another good resource is mentalhealth.gov. This one is hopefully not as overwhelming as some other resources, which are more comprehensive. Again, I'd start with Medline Plus, but if you or your patrons would prefer a resource that's specifically focused on mental health, this is a good one to start with. On the homepage, you can easily see where to get help immediately. There are links to the National Suicide Prevention Lifeline. There's information for veterans and the Veterans Crisis Line, and mentalhealth.gov also has information for young people, older adults, and more. I also want to draw your attention to the tabs at the top, which are basics, what to look for, talk about mental health, and how to get help. There are specific resources under each of these tabs, and we're going to talk about programming in a minute, but I did want to mention that there are toolkits under the tab Talk About Mental Health that has toolkits about starting a conversation in your community. And I'm sure many of us are more aware now of what the Centers for Disease Control does, but what you may not know is that CDC also provides information on mental health, both for professionals and for the public. Their website has information on mental health, including tools and resources, quizzes, and data. And the CDC mental health resources can be good to educate yourself or to gather information for a program or service, but members of your community may also find it helpful as well. Another organization that provides mental health resources is the National Alliance on Mental Illness, or NAMI. NAMI has resources for people with mental health conditions, including peer-to-peer support groups throughout the United States, as well as mental health education resources and classes. So the resources I just went over can be helpful when updating your subject guides or toolkits. They also may be useful when you're creating services and planning programs. Next, I'm going to talk through some ideas for services and programs that you might host in your own library. So have any of you ever hosted or visited one of the National Library of Medicine exhibits, such as the Harry Potter exhibit or the yellow wallpaper at your library? If you happen to, please do put that in the chat because I'd love to know. But these traveling exhibits are curated exhibits on a variety of health issues. The photos and information are from the collections of the National Library of Medicine. There are these large cloth panels on stands, which can be displayed in your library. They're shipped to you for a specific period of time, and then you ship them on to the next library. I'm happy to share that the traveling exhibit program is restarting its schedule for 7 exhibitions. And in fact, the applications to host a traveling exhibit for that group just opened today. So you can learn more about the traveling exhibits and how to request to host one by joining the Making Exhibitions Connections listserv, and the link to that information is on the handout. I did want to mention that one of our newer NLM exhibits, which is not part of that 7 that you could sign up for, but there is an exhibit called Care and Custody, Past Responses to Mental Health, and it explores the treatment of people with mental health conditions in the past, and it examines history to understand how the country has moved away from custodial forms of treatment to more inclusive approaches that have worked to protect the rights of people with mental health conditions. The online exhibit includes an educational component and a digital gallery of selected works from the historical collections at NLM. And I also wanted to just mention, even if you don't want to host an exhibit, you can access the online exhibits at any time. And there's a lot of virtual resources there, including like ideas for programming or photos. So that is all available. Many graphic medicine books address the topic of health, including mental health, creating a unique opportunity for readers to learn about healthcare experiences. Now I'm realizing I should mention what graphic medicine is in case you're not familiar with that term, because I certainly wasn't when I joined the NNLM. So graphic medicine is using graphic memoirs typically, but graphic medium to that talk about a health topic. So it's basically a way to open up a discussion around a health topic through the use of graphic memoirs. So, and there's a lot of information on the site that I'm going to mention. So the graphic medicine website, graphicmedicine.org, has a blog and a podcast and lots of great books to feature and perhaps to purchase for your collection. So there's a lot more information about that on their website. Graphic medicine ill-conceived and well-drawn is an NLM exhibit. So those NLM traveling exhibits I mentioned, and it's about the use of comics and graphic novels as a way to communicate about health, including mental health. And this is one of the exhibits that you could apply for with this round of NLM traveling exhibits if you're interested. In addition, here in Region 7 only, one of our staff has a really special interest in graphic medicine, and she's created a number of book club kits, which we're able to circulate. And I'll talk more about those in just a minute. In 2020, the World Health Organization produced an informative resource using the graphic novel approach called Doing What Matters in Times of Stress. It helps equip people with practical skills to cope with stressful situations. This resource is downloadable and it's available in, I believe, 28 languages. It's about 132 pages and it looks very much like what you see on the right-hand side of the screen. So not 132 pages of paragraphs of text. They also have some audio files on topics such as building awareness and audio exercises, and some of those are available in multiple languages, but they're also available at that site, which I think is a great resource. You might consider hosting a comic artist at your library to give a program for teens or adults where they could learn to create a comic to address some challenging time in their life.
Benny, I just have a
Sure.
question. What is the age of the intended audience of graphic medicine?
It really depends on the book. So, and I'll talk a little bit about this. You know, we don't tell people what to do, but we do have a couple of books that are specifically YA, but you could choose your own, and there are titles that I won't discuss, but now I'm completely blanking, but there are middle grade graphic novels that do touch on health topics. So you could certainly pull those from your collection, but the graphic medicine book club kits that I'll talk about are typically probably either teen or adults, but it really is up to your comfort level and what you decide. But we do have a couple of books that are specifically YA.
Great, thanks, Benny.
Okay, sure. Our graphic medicine book club kits are really popular and they're available on a variety of topics. So I've included just a couple of screenshots of some of the books. Again, those kits they only circulate in Region 7, and the kit includes 6 copies of the book supporting health information and a discussion guide, and they're loaned for 6 weeks at a time. And the process is very easy. It's free. The shipping is free, and we provide a free return shipping label. So all you have to do is pack it up and send it back when you're finished, the copies of the book. Some of the topics that we have kits on include familial substance use, aging, mental health, emergency preparedness, and a lot more, and it keeps growing. You can check out our website to learn more or to reserve a kit. And I did want to mention again that Hey Kiddo was our first which is about familial substance use, was our first book that's specifically YA, but I know we have another kit. I just can't remember which one it is. And even if you aren't interested in reserving a kit, you can still go to the NNLM Region 7 web pages, and there's more information about graphic medicine, including book descriptions for the books that we have kits for, and book discussion guides that you can download. And as I mentioned before, my colleague Sarah Levin-Letterer has a special interest in graphic medicine, and she coordinates those kits, but she's also available to consult on the kits as well as other graphic medicine interests, including helping you identify titles that you might already have in your collection that might serve as a book discussion topic. And I am not overstating when I say she loves to talk about graphic medicine, so she's always happy to hear from anyone who would like to chat about that in any way.
Do you have
Yes.
Sarah's contact info, or will that be shared in the
I'll
slides?
share that. I'll be happy to share that.
Okay,
I
thanks.
would just making a note.
Okay.
Okay, yes, I'll be happy to do that. So as many of us know, books can make it easier to talk about topics that we may know little about or that we just are trying to introduce. The NNLM Reading Club offers titles and added information regarding health topics to enrich your discussions. So these kits provide, so this is different than the graphic medicine. This is an online kit, basically. So the kit provides marketing materials, book discussion questions, health information, and book recommendations with those, with information about the books, so that you could host your own book discussion in your library. There is an NNLM reading club devoted to mental health, including several book choices for discussion. There is a link on the handout to the book club's selection. And if you're interested in attending a virtual book discussion, this is just for libraries and library staff. We do have a group that hosts 4 book clubs each year called the Book Discussion Group. So if you want to meet with other library folk to talk about health-related books, that is also an option. And they read them over a 3-month period, and then they have virtual discussion groups. And there is also a link to that group in the handout as well. So May is Mental Health Awareness Month, and you may want to plan an event or provide information on awareness to your community during that event. So some organizations provide social media images and texts and hashtags that you can use to promote an event. Hashtags like hashtag Mental Health May or hashtag Mental Health 2022 and hashtag Mental Health Awareness are examples of what some organizations have used for social media outreach in the past. Try keeping a lookout for the popular hashtags of 2023 and use them if you use social media. I've noticed that some organizations have started releasing campaign toolkits for 2023, so there is information available if you need help planning. Stigma can be a real barrier to people for seeking help for their mental health. Participating in a Stop Stigma campaign can be one way to bring awareness and reduce stigma in your community by discussing how mental health is part of one's overall health. And therefore, it's interrelated with any other health topic. Your libraries can do this through your social media, or you could think of creative ways to participate, such as offering stickers or wearing t-shirts or even holding a button making contest. These are some potential ways to think about addressing stigma. So now I've given you a lot of ideas, but here are a few more. These are some other possible resources or programs that you might want to consider at your library. I know pre-pandemic, some academic libraries would bring therapy dogs around finals time to help students reduce their stress. Events like that can help give people permission to talk about mental health in an open environment, breaking down that stigma, and give the library a chance to provide additional mental health information. Some of the examples here are possibly downloading resources on meditation or getting handouts from local agencies or creating wellness journals, but there's a lot of different possibilities. And if you have ideas of things that you've done and want to share those, I'd love to hear those too. And if you're still not sure what program to offer, here is one more resource. The Programming Librarian is a place where libraries can share and find, many of you are probably familiar with this resource already, but it's a place where libraries can share and find programs focusing on health or other topics. You can search by the type of library or the topic. And here there's a posting by Noah Lenstra about self-care for university students. So now just to review some take-home points for today, when conducting a reference interview for a mental health question, use the same approach as any other reference interview. Respect confidentiality, actively listen, be empathetic and patient, and know the difference between providing health information and giving health advice, and stay within scope. And 2, cultivate your knowledge of reliable mental health and medication resources so that you know where to look when patrons have questions. And this is one last slide, just in case you find that you're very interested in knowing more about consumer health, there is a consumer health information specialization. So as you, all the courses that are offered by the NNLM again are free, and you can accumulate credit. And then after you've shown that you've taken courses covering a number of competencies, you can apply for your consumer health information specialization. And right now we still do have some free, we still have some money to pay for that specialization for people in our region. So if this is something of interest to you, again, please reach out and I'll provide my email address as well. And I'm happy to talk you through the process or the pros and cons or anything like that. And again, our free continuing education opportunities, we have live classes, guest speakers, and on-demand classes where you can learn on your own time. And many of our classes do qualify for a specialization towards that specialization. And on this slide, just there are a couple of on-demand classes that are listed. So consumer health collection management is one course that's offered, health literacy on demand, which I mentioned before, Medline Plus. So if you want more of a refresher on what Medline Plus is, that's a 1-hour interactive tutorial, prescription and over-the-counter drugs. So there's a lot of options on demand that you could do at any time. And so just thank you so much. And I'll put that link in the chat in just a second for that handout that I keep talking about. But also, we do use some various social media platforms, but the best way to know what we're doing, such as when we're going to be releasing funding, like open up for funding applications, or if we're training, or other things that are happening regionally, is to take a look at our newsletter. It's a weekly newsletter, and it provides all that information if you want to hear what's going on with NNLM Region 7. And thank you so much for your time and attention today, and I'm happy to take questions or do a Medline Plus demo, whatever would be most helpful.
Yeah, I'll just share this a message from Angela, who told us their library makes a table available to community organizations. They sign up for a month and put out their giveaway items and pamphlets, and they get a lot of mental health agencies who sign up to do that. So that's one way that
That's
they
great.
share info.
Yeah, that's great. And then people can stop by at their own, on their own time and see. Wonderful.
Yeah, and then Owen says his library in Elmira also offers tabling to local organizations. So that seems like a great way to get information out there. Did folks want to see a demo? I guess we could do that if you have time, Benny.
I do. Let me just drop these links in before I forget.
Oh, sure.
Let me do that. So this is the link for that handout. And if you have trouble, I will also share all of this with Katura. So she'll have that. Also, if you're interested in signing up for our newsletter, no pressure, but I will put that in the chat too. And I'll put my email address. And actually, if you email me, I'll make sure to get Sarah's email, but I'll send that to you as well, Katura.
Okay, that sounds
I
great.
just
Thank you.
I don't want to mess it up, so I'm going to make sure I
Yeah,
get it right.
that's fine.
Okay. Great. Let me get set up for Line Plus. Okay. Okay, are you seeing the web page? It should say welcome to Medline Plus.
Yes, we see that.
Okay, and I was mistaken. They have changed they updated the web page on me. So it doesn't look exactly like I said, but I did just want to mention, so again, anytime you want to get back to the homepage and just click on this Medline Plus icon, you can click here if you want to view the page in Spanish. And I'll just take a look. And again, this is the medical encyclopedia, healthy recipes. And here's health information in multiple languages down here. And I'll just do a search. Okay, so move. Okay. So, and thankfully it does things like autofill for me. So acetaminophen.
That's handy.
Yes. So this, if you navigate this way, you're going to get from the search box, you will get everything in Medline Plus related to acetaminophen. So you're going to see everything here that has anything to do with acetaminophen. What I really meant to do was to search the drugs and supplements page. So I'll try that again. So I just chose A at the top for acetaminophen, and I am going to scroll down. Okay. So like on that other page, there's a guide at the top for the questions that will be answered through the document. There's the warning information in the red box. Why is this medication prescribed? How should this medicine be used? Other uses, special precautions I should follow, dietary instructions, what if I forget a dose? There's a lot of information here. And then the brand names are listed down here as well. I guess it's not everything that has acetaminophen, but it's some of the common brand names that you might see. And if there's something that someone specifically would like me to search, I'm happy to do that, or I could. So when I first showed you the health topics, the person had navigated by going to this health topics tab, and then it's going to give you ideas that you can choose from. And they started with mental health and behavior. And then you have all of these different topics that you could search. And we'll get child mental health because that's what we've looked at already. And I can just point out, so again, here's that table of contents at the top. There's a brief summary, and then the start here information, which is going to be more basic information. And the other things. The other thing I did not mention, but I will, is there's a medical encyclopedia that is part of Medline Plus, and this is a wonderful resource because, again, it's written in plain language. So what they do on the topic pages is they'll list sections from the medical encyclopedia that you might encounter if you're looking at terms in terms of child mental health, some other things that you might be interested in, or topics that might come up as you're reading. There's also the related health topics. the other national institutes of health that address this topic. And there's some articles. Sometimes if there are resources in languages other than English, those will also be listed here along this side as well. But
Great.
I'm happy if there's a topic somebody would like me to look up, or I'm happy to stop. Either way is fine.
Great, thank you. Yeah, unless anyone has anything specific they want to put in chat or any last minute questions, go ahead. Otherwise, we can let Benny go. Thank you, Benny. That was a really great, informative presentation. And I will send out a link to the recording and the materials that we've mentioned, so you can all share those with your coworkers or use them. Otherwise, thank you very much, Benny, and
Thank
have a
you so
great day,
much for having
everyone.
me.
Yeah, absolutely.